Lady Smith.
Well, thank you, Madam Speaker, and I'd like to thank the honourable member for his speech and for bringing up Joyce Echaquan and the issues around healthcare with First Nations. I had the honour and privilege as a filmmaker before I became a parliamentarian of working on a film for the Hulkaminum Health Hub and working with elders to create a video that was used and is used now to train people that go into the healthcare system as part of their orientation, to understand the culture, the Snawaith, the way of life, and the traditional healing techniques that the Hulkaminum people use, and also to teach these healthcare professionals about the history of colonialism, the residential school system, the Indian hospitals. We had an Indian hospital here in Nanaimo, which was an abhorrent place. Lots of horror stories came out of that place as well. And I'd just like to ask the honourable member about the need for education for people working in all fields, but particularly in healthcare, and because of the systemic racism that First Nations people, Indigenous people face in the healthcare system, and how he would see that improving the situation in his riding.
Joliette.
The Honourable Member for Joliette. Thank you, Madam Speaker. I want to thank the Honourable Member from Nanaimo Ladysmith for his question. I would ask him to send me the information about the documentary. I'd like to be able to watch it myself. Please send it by email. Obviously, there's a way of healthcare that can change the tragedy that we saw with the Manawan community. When I was with my colleague, the member for the North Shore on the Hill, we met the Atikamekw members who came to hold a vigil a few days after the event, and we heard a number of people say that their mother tongue is not French. They go to the hospital and the doctor speaks to them and he doesn't understand. And he says yes or no, and they based on keywords that they try to decode. And if there is a death, they wonder if it's their own fault because they misunderstood what the doctor said. Perhaps I misunderstood. Things have to change. The Joliette Hospital has an interpreter, but the night of the tragedy, the interpreter wasn't even called upon. So things have to change so this never happens again, Madam Speaker.
Or Peace River Westlock.